Hi, my name is Joshua Jocson. I'm currently taking Medical Clinical Administrative Professional program at the School of Career Education, Riverside County Office of Education, and my teacher is Mrs. Kiler, and my class is part of the Health and Science Technology sector. I'm currently taking this class as a medical assistant as a stepping stone to become a physician assistant. Working 2,000 hours as a clinical medical assistant, I will also be working on my bachelor's degree of science. In order to become a physician assistant, I will need to take a 3-year physician assistant program. I am very confident in this MCAT program, which will lead me towards my dream of becoming a physician assistant. Today I will be demonstrating 2 procedures, Venipuncture and Intramuscular injection. I will also give a brief lecture about systemic and pulmonary circulation. Pulmonary and systemic circulation of the heart. I'm going to start with the pulmonary circulation, and here we have our heart, and I'll be starting in the right atrium. From the right atrium, blood comes in from the body through the superior and inferior vena cava, and then blood comes in, it goes into the right atrium, and when the right atrium contracts, the tricuspid valve right here will open up and allow the blood to rush into the heart, into the right ventricle, and from the right ventricle it will relax, and then when all the blood is inside, the right ventricle will contract, the tricuspid valve will close, the pulmonary arteries valve right here will also open and allow blood to go from the ventricle to the pulmonary artery, and from the pulmonary artery the blood goes into the lungs, and with the lungs alveoli, gases will exchange and oxygen will enrich the blood. From the lungs, the blood goes into the pulmonary vein, like right here, and from the pulmonary vein it will go into the left atrium, and when the left atrium contracts, the bicuspid valve will open up and allow blood to go into the left ventricle. From the left ventricle, blood will go into the aorta. When the left ventricle contracts, the bicuspid valve will close, and the aortic valve will open up and allow blood into the aorta, and from there we have the systemic circulation. So from the left ventricle, the blood will go in through the aorta, and the aorta to the rest of the body, and oxygen will be given out throughout your body, and blood will come back into the veins via capillaries, and then through the superior and inferior vena cava all the way back into the right atrium.
I will be performing an intramuscular injection, and first I'm going to take the dosage into my syringe. When I first get my medication, I'm going to check 3 times the expiration date. The first time is when I get out of the cabinet, so this is 2017, so we're good. The second time is before I withdraw the medication with the syringe, and the third time is before I inject the patient. I will check.
After checking the medication 3 times, I'm also going to be compliant with the 8 right rule. Checking the right medication, the right dosage, the right time, the right patient, the right route, the right technique, the right site, and the right documentation. Now I'll be withdrawing the medication. The first thing I'm going to do is sanitize my hands. Then I'm going to apply my gloves. Next thing I'm going to do is I'm going to disinfect the medication. gonna swipe once. And as the alcohol is drying, I'm going to prepare my syringe. I'm now going to prep my dosage. While withdrawing the medication, I want to make sure that there are no air bubbles. And then I want to put the cap back on without recapping completely. That was called the scooping method, so I don't recap completely, but I put the cap on lightly. Transfer my supplies. Have a cotton ball. So along with my supplies, I'm also going to have a bandage, and I'm going to take off my gloves. And then re-sanitize my hands before I go to the patient. Now that I have everything ready, I'm ready to go see the patient. So first I'm going to knock on the door and then see if they're ready. So come in. Hello, I'm Joshua Jocson. I'll be your medical assistant today. May I ask for your full name and date of birth?
My name is Lucy Jocson. I was born January 1st, 1957.
Okay. Today we'll be doing an intramuscular injection based on the doctor's orders. I already have the dosage ready. And alright, how are you, Mrs. Jocson?
Oh, I'm doing great. Thank
Okay,
you.
That's good. Which arm would you prefer?
I would prepare on this side, please.
Okay, I'm going to ask you to roll up your sleeve.
Okay.
And then relax your arm
I know.
and hang it down.
Like this is good?
No, hang it down like this.
Okay,
Yes,
thank you.
Now I'm going to sanitize my hands. Apply my gloves. For intramuscular injection, we have 3 sites. There's the dorsogluteal, the fasciculus lateralis, and we have the deltoid. I will now sanitize the area 3 to 4 fingers below the acromion. Make sure to do it, sanitize in a circular motion 2 inches away from the injection site. I will prepare my Band-Aid. My cotton ball ready. And I will drop the cap without touching. Stretch the skin. Aspirate. Make sure there's no blood. And inject. Safety cap the needle away from the patient. And now I will throw away my cotton ball. By my bandage, I want to make sure that the patient isn't bleeding anymore. And I also forgot to mention that during the injection, that the bevel should be up for the syringe. have any plans this weekend?
Oh, nothing. I'm just trying to be resting at home. Maybe do some gardening. That's it.
That's good. I'll be performing my second procedure today. It is venipuncture. There are 3 sites for venipuncture. You have your median cubical vein, you have your cephalic vein, and then you have your basilic vein. We want to avoid using the basilic vein because it is dangerous and causes the most needle stick injury. It is near most of your nerves. We're going to be focusing on the median cubital vein because it is the most prominent, it is the safest, and it is well anchored. I ask your name and date of birth.
My name is Lucy Jocson, 11957.
Okay, we'll be performing a venipuncture,
Okay.
and I'm going to ask which arm would you prefer?
I will prepare this side.
This arm?
Mm-hmm.
Okay. I'm going to locate her median cubicle using the palpation method.
Mm-hmm.
I'll be looking for a bouncy or pounding sensation. I will also be looking for the direction of the vein. Okay. After identifying the vein, I will sanitize my hands. Apply my gloves. I will assemble my supplies. I've assembled my supplies. I have also 2 vacutainer tubes, a tiger stripe, and a lavender tube. In order, I will be using the tiger stripe because it is a metabolic panel vacutainer, and then the lavender is for a complete blood count. I'm going to disinfect her arm. I'm going to disinfect in an inner-outer circular motion to go around 2 inches radius. I'm going to ask you to close your make a fist.
Okay.
I'm going to apply the tourniquet.
Mm-hmm.
I have my needle and my vacutainer ready. My cotton ball ready. Gonna make sure the bevel is up. Make sure I'm well anchored. This is the only vacutainer I'm going to be using, so I'm going to raise the tourniquet. And close the needle away from the patient. I'm going to ask you to put pressure on that.
Okay.
And I'm going to dispose of this in the sharps container. Off my gloves and re-sanitize my hands.